Hey, Dr. Uhrmacher here. In the last video that I did, the tutorial, I walked you through my favorite strategies, which is obviously lead generation. And then with Facebook, you can actually set up a retargeting sequence, almost like your autoresponder series, so that you can retarget all the people that did not opt in, which is generally around the 90% mark. So it's a large number. So to be able to retarget those people is really critical. Now I wanted to address some of the questions, concerns that I get from that type of training then is I'm not getting the results. You know, whether that's your clicks, anything else. For one, so you got to come in here, and this is an ADHD ad that I did. These are always changing, okay? Because they'll sometimes they'll last for a week, 10 days, sometimes they'll last for a couple of months, but you always have to be ready for the next one to change up the ads. So this is one of them. It needs to talk directly to who you're trying to go after. Okay, so everything that I'm looking at here is ADHD as far as the ad, ADHD as far as the landing page, the squeeze page, and ADHD as far as the report that I'm delivering. Okay, so take a look at this one. All that needs to be congruent, talking directly to that person. All right, you see how this works then? This one is all about ADHD. And then the landing page, so it all needs to be congruent. The purpose of the ad is to get someone that has concerns about ADHD to click on the ad. Keep that in mind. Each one of them has their conversion point. That is the purpose of the ad, to be specific to the prospect that you want to talk to. Don't make it a wellness. You're going to get maybe a lot of clicks. You're going to be very non-specific though, and you're going to get probably poor results across the board. So I'm talking directly to basically a parent that has a child with ADHD. The image grabs their attention. Then when they get to the squeeze page, I want their name and email address. Now, of course, this talks directly to them. It's a little bit controversial, but it's saying ADHD, all right? And of course, a lot of them have done medication, diet, behavioral therapy, traditional treatment. So I'm saying when those have failed, because most have been through those situations. And then when they get here, it's talking all about ADHD. So that's what you need to keep in mind when you're going through this is, am I talking directly to the parent of a child with ADHD? If you can answer yes to that, then you're probably getting good clicks, you're getting a good click-through rate, you probably got a good cost per click. And if that's the case, is your squeeze page still doing the same thing? Is it talking directly to that person? And now there's lots of different squeeze pages too. You can have this one, you got to be testing those. There's some that I'm actually going to look at testing, moving this entire portion over to right here and putting in some bullet points along here. You know, so again, to give them just the amount of information to get them to trade you email. So if you're hovering at a 10% opt-in rate, you're not doing too bad. That's pretty good. But I'm always testing to try and raise that, trying to get 13, 14, 20%, and always trying to improve on those. And then again, come in here with the report, whether you deliver it as a report, whether you deliver it as a video, whatever the case may be. The purpose of that video then is obviously for them to pick up the phone and call you, or to fill out a form. I always like to have them fill out a form for like a new patient visit. So then, as I talked before, it takes them to another page then that I can cookie them, and I know that that person gave me their email first, so they're in the autoresponder sequence. But I also know that now they requested to have an appointment with me, so I can talk differently to them. All right, so then there's that other conversion point of actually picking up the phone and calling from that new patient deal. So hopefully that helps out as far as what you need to be doing across the board. These three metrics is, are you getting good clicks? Are you getting good opt-ins? And are you getting good numbers as far as the number of people that end up showing up here? Are you getting a good number of those people to actually pick up the phone and call you? And again, that comes back to your ROI. So you could be getting cheap clicks, but if you're not getting people from this point to call you, well, then all they are is cheap clicks. So if you spend 100, 150 bucks here and you get someone to call you and come in and be a patient, that's a really good number, okay? That's one of those things that you're going to be looking for and that's going to work out for you. Let me know if you have any questions.